Good morning, students. Today we are going to discuss internal anatomy of the laryngeal cavity. The three important functions performed by larynx are: it acts as a passage for air, it produces sound, and prevents aspiration. Laryngeal cavity is anatomically modified for performing these functions. The cavity of the larynx is lined by respiratory epithelium except over vocal cords. It is divided into regions by means of two folds. The vocal folds produce sound and the vestibular folds help vocal cords in performing functions of larynx. Cavity of the larynx extends from inlet to the lower border of cricoid cartilage. It is divided into three regions. Upper region called vestibule is situated between inlet and vestibular folds. Middle region called ventricle lies between vestibular folds above and vocal folds below. The lower region of larynx lies between vocal folds above and lower border of cricoid cartilage. Sinus of larynx is a small recess on each side of larynx between vocal and vestibular folds. Saccule is a diverticulum of mucous membrane that extends from the sinus, and its mucous secretions lubricate vocal cords which lacks these glands. Interior of larynx is lined by respiratory epithelium except over vocal cords and small portions of epiglottis. The arterial supply of the larynx comes from superior and inferior laryngeal arteries. It is drained by superior and inferior laryngeal veins. Interior of larynx gets its sensory supply from terminal branches of vagus. Laryngeal cavity extends from the inlet to the lower border of cricoid. So superiorly it is bounded by epiglottis and inferiorly by inferior margin of thyroid cartilage. Above the vestibular fold is vestibule of this cavity, and below the vocal fold is subglottic region. Supraglottic region of this cavity lies above the vocal folds, and infraglottic region lies below the vocal folds. Between the vocal and vestibular folds is ventricle of larynx. On either side of the ventricle is a diverticulum lined by respiratory epithelium called saccule of larynx. Inlet of the larynx is bounded anteriorly by epiglottis, on either side by aryepiglottic fold, and posteriorly by interarytenoid fold. The contents of a aryepiglottic fold are cuneiform and corniculate cartilages. Laryngeal inlet can be seen on clinical examination using indirect laryngoscope. It is bounded anteriorly by epiglottis, on either side by epiglottic fold, and posteriorly by interarytenoid fold. Cavity of larynx presents two folds: vestibular fold, which is also called the superior fold, and vocal fold or inferior fold. Between the two folds lies ventricle of larynx. So cavity of larynx extends from epiglottis above to the lower border of cricoid cartilage below. It is divided into regions. The regions are upper region, which is also called vestibule of the larynx, lower region, which is also called subglottic region. Between the vestibular and vocal folds lies ventricle of the larynx. On either side of the ventricle is a diverticulum lined by respiratory epithelium called saccule of larynx. Epithelium of the larynx is very important. Whole of the laryngeal cavity is lined by respiratory epithelium, but epithelium over vocal cords is stratified squamous non-keratinized type. In humans, the thickness of this epithelium is 5 to 10 cells. It gives protection against trauma. Mucous glands are present throughout except in the region of vocal cords. Glottis is lubricated by mucus secreted by glands in the saccule which trickle down. The lamina propria is loosely attached throughout the laryngeal cavity except over glottic region, where it is firmly adherent to underlying structures, which prevents development of edema in case of inflammation in this vital region. The lining of the vocal cords are: it is lined by stratified squamous epithelium resting on basement membrane. Submucosa is absent in this region. Lamina propria is divided into three zones. Superficial lamina propria is also called rinky space. Intermediate lamina propria and deep lamina propria together constitute vocal ligament. Deeper to vocal ligament lies vocalis muscle. Vocalis muscle is important for movements of vocal cords for the production of sound. What is Rinke's edema? Collection of inflammatory fluid in the Rinke space is called Rinke's edema. What are vocal nodules? They are also called singer's nodules. They're caused due to voice abuse, commonly found in teachers, preachers, and singers. The anatomical site of these vocal nodules is at the junction of anterior two-thirds and posterior one-third of vocal cord. Vocal rest is given as a treatment for this condition. What are vestibular folds? Vestibular folds are also called superior or false vocal cords. They do not participate in the production of sound. They are thick folds of mucous membrane above vocal folds, each enclosing a narrow band of fibrous tissue, the vestibular ligament. They do not take active part in voice production but facilitate other functions of vocal cords. Saccule is a space between vocal and vestibular folds. It is lined by respiratory epithelium. It is rich in mucous glands. The mucus secreted by these glands trickles down and lubricates vocal cords. In this anatomical specimen, the arrow 2 represents vestibular fold, arrow 3 represents vocal fold. Between the two lies saccule of larynx, which is a diverticulum lined by respiratory epithelium. Now, what is ventricle of larynx? Ventricle of larynx lies in the cavity of larynx. It is bounded superiorly by the vestibular folds and inferiorly by the vocal folds. What is laryngocele? Laryngocele refers to dilatation of saccule of ventricle, usually unilateral, can be acquired or congenital. Acquired is the commonest form. A patient with saccule of larynx may present with a swelling in the lateral side of the neck. Diagnosis is done by imaging like X-ray, CT, and MRI. Different types of saccules are internal, which is also called simple. Here, the dilated ventricular saccule is confined to the parapharyngeal space. It is contained by the thyroid membrane. In external type, saccule herniates through the thyroid membrane and the superficial portion is dilated. In mixed variety, there are dilated internal and external components. Rima vestibuli is space between the two vestibular folds and rima glottis is space between the two vocal folds. Between the rima vestibuli and rima glottis lies ventricle or sinus of the larynx. Arteries supplying mucosa of larynx. Above the vocal folds, superior laryngeal artery, which is a branch of superior thyroid artery and supplies mucosa of the larynx above vocal cords. Below the vocal folds, mucosa of the larynx is supplied by inferior laryngeal artery, which pierces cricothyroid membrane and is a branch of inferior thyroid artery. Veins of vocal cords. Above the vocal cords, mucosa is drained by superior laryngeal vein, which after piercing the thyroid membrane drains into the superior thyroid vein. Below the vocal folds, it is inferior laryngeal vein, which drains into inferior thyroid vein, which in turn drains into left brachiocephalic vein. Lymphatics of laryngeal mucosa are important because malignancies of the larynx spread through these lymphatics. Above the vocal folds, lymphatics of larynx pierce thyroid membrane and drain into the superior jugular group of lymph nodes. Mucosa of the larynx below the vocal folds drain into inferior jugular group of lymph nodes. Some of them may also drain into the mediastinal nodes. Vocal cords have no lymphatics. Carcinoma of the larynx spreads by lymphatics to regional lymph nodes. What is Dolphian lymph node? It is a midline lymph node draining larynx and thyroid. Its involvement means metastasis either from larynx or from thyroid. Sensory innervation of laryngeal mucosa. Above vocal cords, laryngeal mucosa is supplied by internal laryngeal nerve, which is a branch of superior laryngeal nerve. Below vocal cords, mucosa of the larynx is supplied by inferior laryngeal nerve, which is a branch of recurrent laryngeal nerve. It pierces cricothyroid membrane to supply the mucosa of larynx below vocal cords. What is nerve supply of mucosa over vocal cords? Mucosa of larynx over vocal cords is supplied both by branches of internal laryngeal and inferior laryngeal nerves through gallus anastomosis, which is a direct connection between dorsal branches of internal laryngeal and inferior laryngeal nerves. Gallus anastomosis supplies mucosa or vocal cords. There are various forms of gallus anastomosis. It may be in the form of a single trunk, double trunk, or in the form of a plexus. Now let us go for a quiz based on this lecture. Which of the following is false about vocal cords? They are lined by respiratory epithelium. They contain vocalis muscle. Mucosa or vocal cords lack submucosa. They produce sound. A is false statement. Which of the following muscles produces tension in vocal cords? Cricothyroid, interarytenoid, transverse arytenoid, posterior cricoarytenoid. A is correct option. Which of the following is false about vocal cords? They are lined by stratified squamous, which is non-keratinized. Lymphaticus from vocal cords drain into deep cervical lymph nodes. Sensory innervation is from inferior laryngeal nerve. Internal laryngeal nerve gives sensory innervation. B is wrong option. Which of the following is a feature of vocal cords? They are drained by lymphaticus. Submucosa is present, also called vestibular folds, lined by stratified squamous non-keratinized epithelium. Lamina propria of vocal cords is divided into how many zones? 1, 2, 3, 4. C is correct option. Rinky space is which layer of the lamina propria? Superficial, intermediate, deep, and B. It is the outer or superficial layer of lamina propria. Vocal ligament consists of following layers of lamina propria: superficial and intermediate, intermediate and deep, deep and superficial, intermediate and superficial. B is correct option. Vocal cords are lined by which type of epithelium? Simple squamous, respiratory, stratified squamous non-keratinized, stratified squamous keratinized. C is correct option. Which of the following in larynx is deficient in mucous glands? Vocal folds, vestibular folds, ventricle, saccule. A is correct option. Vocal folds are deficient in mucous glands. Lamina propria of laryngeal mucosa is firmly adherent to underlying structures in vocal folds, vestibular folds, ventricle, saccule. Vocal folds is correct option. Thank you for watching this video. Do not forget to like, subscribe and share this video.
Do not forget to subscribe my channel. Press on the bell icon to remain updated about more video uploads.